do to help when you have pain. And the next slide. Okay, the first one is medications, and this is a minor topic. And medication. Once we have pain, we're over the counter and we are getting the tablets, to stop the pain because it's actually an unpleasant feeling. And actually, which is good because there are some medication that you can take and ease that pain to actually help you to carry out your activities. And it should be for a short term, and this is why we're here to encourage you so that you can actually take the over-the-counter medication like paracetamol, but for a very short term. Why should it be short term? To help you and allow your body to do the exercises that will be prescribed to carry out your activities of daily living, which is very important for healthy living. Okay, so well, like I said initially, paracetamol, Nurofen, ibuprofen. I put an asterisk on ibuprofen because it actually has some side effects. Paracetamol also has some side effects, but then ibuprofen cannot be prescribed for some people that have, some gastric conditions. So that is why I put an asterisk there. And for the prescribed medications, which must be taken on prescriptions, they are very important that they should be prescribed because they have some side effects that if they're not prescribed and you just take them, you could be harming yourself, like cocodamol, and it has to be prescribed because of the number of time you have to take them. So if you take them more than it should be required to be taken, then you could be harming yourself. So cocodamol and some strong pain medications should and must be prescribed. And please, you can speak with the pharmacist if you're unsure about the paracetamol, or maybe if you're taking them and you think you're quite unsure about it. Please, you can involve your pharmacist. Okay, thanks. And that was actually the link for getting other medical advice. Okay, and then the next one is exercise. And that is why we are here as physiotherapists. And each time you walk into a physio office, maybe for consultation, you might actually be like, why am I getting this exercise? I came here for pain and then you're giving me exercises. Are you really serious? So what does this actually involve? It involves low intensity, intentional movements. It could be aerobics like running, it could be cycling, and it could also be for the purpose of strengthening, and it also could be for the purpose of stretching. So why should you exercise? Why is it that each time I see a physiotherapist, they will give me exercises? Why? So this is because for health benefits, it will make you stronger, it will make you more flexible, and it will make you fitter. And also, this can actually reduce pressure on your joints. Like if you have joint pain, knee pain, elbow pain, lower back pain, it will actually reduce the pressure, which is causing, joints rubbing together and then eliciting pain. It will reduce that pressure from the joints, and it will also release endogenous opioids for pain relief. What do I mean by this? It will actually stimulate the brain to release endogenous opioids. These are natural pain relieving substances that the brain naturally produces. So when you do exercises, the brain is stimulated to produce those endogenous opioids, and then your pain is relieved. So would you do exercises? Do you do
Yes.
exercises?
Yes.
Okay. So about the dosage, so exercises. I think the WHO and has actually made some this prescription at least 75 minutes per week for high intensity exercises like running, going to the gym, doing all those high intensity exercises. You can do that 75 minutes for a week, and for the moderate to low intensity exercises, you can do that for 150 minutes per week. And this can actually be prescribed by physiotherapists, by me, by them, by a lot of physiotherapists all over the world. And you can actually use the link here, the NHS link, to grab one or two advices. Okay. Okay. Relaxation is another way to handle pain. Relaxation. Oftentimes, we actually neglect rest or relaxation as a mode of managing pain, but it's actually a very strong tool to manage pain. So this involves progressively reducing muscle tension on successfully resting a group of muscles, such as progressive muscle relaxation, mindfulness, and breathing exercises. So to exert an effect on the nervous system, the relaxation response must be activated regularly. So what this is trying to say is that to actually see an effect in relaxation as a tool of pain management, you have to do that regularly. So it's not something you just do today and that's it. You go about your activities and you're not like, this doesn't get better. So oftentimes, I must say this, when I ask patients, and what have you done to ease this pain? They name the pain medication, exercises, a whole lot of things, and then they're like, oh, sometimes I rest and then it goes away. I'm not like, you should mention this first. Sometimes letting rest is a very useful tool to manage pain.